Hello and welcome. I am Dr. Parit Ladani, Chief Maxillofacial Surgeon at Nuface, Cleft and Maxillofacial Surgery Clinic, Andheri West, Mumbai. In my 18 years of practice with over 10,000 surgeries performed, one question I often hear from patients is, how do I know if I really need jaw surgery? Today I will share top 5 signs that may indicate you could benefit from orthognathic surgery, also known as corrective jaw surgery. Sign number 1. Difficulty in chewing or biting. The first and most common sign is difficulty in chewing or biting food. If your jaws don't align properly, simple things like eating chapatis, pizza, or even chewing dry fruit can feel uncomfortable. Patients often tell me they bite their cheeks or lips while eating. This is more than just an inconvenience. It means your jaws are not working the way they should, and the jaw surgery could be the solution. Sign number 2. Open bite or misaligned teeth. In an open bite, even when your back teeth touch, the front teeth don't meet, leaving a gap. This makes biting into foods like sandwich or fruits very difficult. While braces can correct minor misalignment, severe jaw-related bite problems usually need orthognathic surgery for a permanent solution. Third sign, speech issues. If your jaw position is not correct, it can cause lisping, unclear speech, or difficulty in pronouncing certain words. Many patients don't realize that their speech issues are linked to their jaw alignment. After surgery, not only does their bite improve, but also speech becomes clearer as well. Sign number 4. Jaw pain, TMJ pains or headaches. When the upper and lower jaw don't fit well, the jaw joint, also called as a TMJ, comes under stress. Over time, this leads to chronic pain, tension, headaches, and even neck discomfort. Orthognathic surgery realigns the jaw, relieving this stress and giving long-term relief for such pain. Sign number 5. Facial imbalance or breathing problems. Sometimes the jaws are too far forward, too far back, or asymmetrical. This doesn't just affect how you look in photos, it can also affect your airway. Patients with receded jaw often complain of snoring, mouth breathing, and disturbed sleep. Corrective jaw surgery improves both appearance and overall health by opening up the airway. So, to summarize, top 5 signs you may need jaw surgeries are difficulty in chewing or biting, severe bite misalignment or open bite, speech difficulties, jaw pain or chronic headaches, or facial imbalance or breathing problems. If you notice one or more of this in yourself or a loved one, it may be a time to consult a specialist. At Nuface Clinic, Andheri West, Mumbai, we provide complete assessment and advanced orthognathic treatment plans tailored to your needs. I am Dr. Parit Ladani and I look forward to guiding you on your journey to a healthier bite and a more confident smile. Don't forget to like this video, subscribe, and share it with someone who may benefit. See you in the next video. Thank you.